more dangerous than COVID-19.
Considered a public health crisis.
It creates this stigma against Chinese and Asian Americans.
Infecting the land of the free.
It exposed long existing ones and exacerbated them and made them worse.
Tonight, how the pandemic has lifted the veil on racism in healthcare.
Racism makes all of us sick.
Racism is a public health issue.
And the solutions to fix what's ailing America.
And welcome to Divide Everyone.
And I'm Alicia Patillo. Tonight we discuss race and health disparities throughout our valley.
We tonight are joined by a series of experts from politics to healthcare experts. They're going to share their stories on the racial inequalities when it comes to healthcare.
Yeah, and we want to start off by going back to August when Governor Sisolak declared that race was a public health issue. And I want to direct this first question to Senator Pat Spearman. First of all, thank you so much for joining us. We really appreciate all of our panel guests for being here. But Pat, do you agree with that statement? And if so, why?
Thank you, Alyssa. Yeah, I do. And I'm really glad that Nevada is recognizing that, and we're saying that publicly. If you look at the Journal of American Medical and any journal that's talking about health, and that's physical health or mental health, you will see that racism, the systemic racism that has already been here, has been a nemesis for BIPOC communities, Black, Indigenous, and people of color communities, because the health system as it stands and as it has stood has failed us. It has failed us because either they're not in our communities, or it has failed us because many times when we present ourselves to a medical community, they don't believe us. I'll share very briefly a story of one of my younger sisters in 2016, had a pain in her stomach, I believe it was, and went to the hospital in Ohio, and she stayed on a gurney in the hallway in the emergency room for about 6 hours. The doctor came in, talked to her for about 3 or 4 minutes and said, go home, there's nothing wrong with you, and then come back on Monday. She went home early morning Saturday, and early morning on Sunday, she was dead. They did not believe that anything was wrong with her. And so, yes, I do believe that racism has negatively impacted the health community, the health of all of our communities.
And so now, from that point, I want to sort of open that up to our guests here tonight and say, what the senator just said, does that ring true to yourselves or personal stories that you've experienced in your own lives?
I'll go ahead and start. Go ahead. I do agree with Senator Spearman, simply because it just seems like in this world, being Black is bad for your health. As a minority community, we are faced with more stresses, which leads to health issues like high blood pressure, diabetes. You're trying to survive. You're living in food deserts. You don't have access to healthy food choices as your non-minority communities do. So you're already at a disadvantage. It's just ironic to me that every time I visit the doctor, the first question on the list of 3 questions is, what's the number for your pharmacy? Without even, talking with me, knowing what's going on, you're automatically prescribing medication instead of trying to come up with a healthy solution on how to solve whatever is ailing you. And so we also know that Black women are more likely to die from childbirth or other complications due to pregnancies. And it's a systematic problem, and that's been around for years and years and years.
And we also have to just look at the actual numbers, right? So we know the national numbers of maternal mortality, 3 to 4 times more Black women die during childbirth than white women. And where you guys are in Nevada, because I'm on the East Coast, where you guys are, the number is 2 times more than white women. In New York, it's actually 12 times more. Where I'm in Boston, actually the same number as you guys, 2 times more. So when we look at the number, why are Black women dying due to childbirth and pregnancy complications more than white women? We can only point to racism and implicit bias being the answer. We know from several research studies now that this is the reason. Just like your governor recently declared that racism is a public health crisis, Our mayor did the same thing. Senators have also said the same thing. And now it's time to put the pressure on our legislator to actually take the next step, which are action steps to solving the problem. I think everyone is tired of statements about racism being a public health crisis. It's now time to take action to eliminate it.
I respectfully disagree. I would like to think that there are no system-born racism in healthcare delivery. It is one of the most diverse industries that we have. According to the American Association of Medical Colleges, that almost half of the physicians in the United States are minorities. We have not even counted the medical workers, where, for example, here in Nevada, a high percentage of that are minorities. Also, medical training dogma of treating those who are ill, regardless of race or socioeconomics, is counterculture to system-sponsored racism. Now, please remember, though, that doctors and medical workers, both white and minorities, are human too. So some of them may have personal biases due to their experiences and background.
And so I want to open up that point to Lisa Pacheco. You're the president of the Nevada Hispanic Nurses Association. So to Sonny's point, what do you say?
Yes, sir. I am. I'm interested in what he has to say, and I would go on to point out that part of getting good medical care and health care in your culture is having somebody who mirrors what you look like taking care of you. And in Nevada, we don't do that. For example, the Hispanic nurses, there is about almost 9% of the nurses, registered nurses in Nevada are Hispanic. We are almost 30% Hispanic in Las Vegas, in Southern Nevada. We have to mirror that number. You want somebody who is like you, taking care of you, that understands your culture, understands your socioeconomic status, understands where you're coming from. And that is how we do good healthcare. That is so vital, so important. And we have to change that. We have to shift that. And I'm so happy to hear that this conversation is happening, because this has been, all of these things that everybody is saying have been discussed time and time again. AWON, we know, the Association of Women's Health, Obstetrical and Neonatal Nurses, we've been talking about the African-American mortality rate in birth for years. We've been talking about it for at least 15 years. What are we doing about it? We need action. It is the time to take action, to make things happen, to change the culture of health in our country. And it's vital. And education is part of it. We need to make sure that we get more nurses that are educated and that are out in the workforce. We need to make sure that we have providers that mirror our culture and mirror the diversity of our communities. Nevada is a very diverse community, and we have not mirrored, our healthcare professionals do not mirror the patients that we are taking care of here in Southern Nevada.
Lisa, I agree with, I agree with you completely. The problem with what we have, though, is we're so short of nurses. If we can, I've spoken to all of our schools here, UNLV, CSN, all of them are working so hard to get more nursing courses done. But the fact of the matter is, we are so short. If we can graduate more Latina nurses right now, believe me, I'm 100% for it. To help our short, we're short on both nurses and doctors here.
Okay,
so,
Sunny, I'm gonna stop you right there. We're gonna just take a pause and go to a quick break, and we'll be right back. Stay with us. Welcome back to Bridging the Divide on KTNV Channel 13. We are discussing the racial health disparities throughout our valley and really around the entire world. So we are joined by lawmakers, health experts, advocates. And so we picked up on our last conversation before we took our break, we were discussing how Governor Sisolak declared that racism is a public health crisis. And we heard from Sunny, who is a part of the Asian Chamber of Commerce here, who does not agree with that statement. So I want to really quickly hear from Tamoria McQueen Saba. She is a mom of two. She's been through quite a scare, and we'll get into that a little later with healthcare, but she's also an advocate. So do you agree with that statement? Do you not agree with that statement?
I completely disagree, but I hear things like this often, and this is the problem in our healthcare system. It is when healthcare providers and others don't believe a patient's lived experience. And it happens all the time. And we now have several organizations, including the American College of Obstetricians and Gynecologists, the largest organization of obstetricians and gynecologists in the world, who've come out and said that racism is a health crisis. They've partnered with other orgs to do this. You can go to their Facebook, you can go to their Twitter. It's pinned to the top of the page. So how can you deny it when you have not ever had this lived experience of a Black person in America who's been on the receiving end of racist behavior? Like, I would never sit and judge any of you or anyone else on this panel about what you've actually lived through and what you've experienced from other people. So when people tell you their experience, believe them. If you are not a Black person and you have not been on the receiving end of racism, whether it's in education or housing or healthcare, how would you know? And the answer is you don't know. And it's not okay to say these things and invalidate these patients, because that is the reason why we're in this crisis, because their lived experiences have not been validated. And that is what has to change.
Thank you, Tamoria. I want to bring in Maria Azzarelli from the Southern Nevada Health District. Can you add to that?
Yes, thank you, Alicia. At the Southern Nevada Health District, we also made an announcement that racism is a public health crisis. And there are many reasons for that. The data shows it. The systemic racism that we've talked about that affects the social determinants of health, where people live, learn, work, age. And so there are so many things that racism affects. And so it is, the CDC has announced it, the public health associations around the country. There are journal articles around it. And further, at the Southern Nevada Health District, we recently conducted a community health needs assessment where we did focus groups and surveys among priority populations in our area, including African Americans, Latinos, LGBT, the elderly population. And a common thread amongst the Latino and African American focus group participants was that they felt unheard when they visited the doctor. They have stories from family and friends that were horrifying, like Senator Spearman's story, where the patient was ultimately died. And so that scares them when they try to seek care. And another common thread was that the access to care was very difficult in terms of even understanding how to navigate the system in our community. And so, you know, it is a public health crisis. We cannot say that it isn't. We have to start with that foundation. And so the fact that it has been called a public health crisis means that we as public health workers, we know how to tackle those issues. You assess, you plan, you implement, and you evaluate your interventions like you do with all public health issues. And so that's why it's critically important that it was classified as that. Thank you.
All right, that's what this conversation is all about, hearing from different viewpoints and trying to have this conversation that at times can be a little bit uneasy, but that's what this whole Bridging the Divide series that all of us here at Channel 13 are trying to accomplish. So we're gonna have more on our Bridging the Divide special coming up after the break. And welcome back, everyone, to our special Bridging the Divide. We're talking about racial inequalities when it comes to healthcare, and perhaps there's no clearer picture right now being drawn for us all than what the coronavirus is doing to communities of color. And I just want to open this up now to the panel. We have about 3 minutes during this break. When we hear about people of color being disproportionately impacted by the coronavirus, I'm curious to get some of your takes as to why you think that is. Let's begin right now with Becky Parkley, a marriage and a family therapist with the Parkley Group.
Thank you. So the first thing that I have noticed, obviously, is just the coronavirus alone has impacted the depression rates, the rates of anxiety. But when I have people come into my office or online, one of the things that has just exploded is something that Tamoria has pointed out just a few minutes ago. And that has to do with the fact that we don't listen to understand other people and their experiences. So instead of listening to people of color or the other people that are in our families, our friends, our neighbors, we just are, especially in social media now, we're doing a lot of dismissing what people say, how they feel, and not just dismissing, but radically saying the absolute opposite of how they feel. And it is tearing down the fabric of our society, and it's building hate, it's building hurt, and it's causing friction within family members. And you add that on top of the coronavirus. And what I've noticed is something very different than anything we've had before. It's adding differences between family members, and it's tearing family members apart, it's tearing friendships apart, and we're just having stronger and stronger impacts within society as a whole. And that has been just painful to see, and it really hurts everybody around us.
Becky, thank you. We have one more minute left, but I want to direct this question to Sunny with the Asian Chamber of Commerce. We have repeatedly heard our president label the coronavirus as the China virus or the Chinese virus. And certain people, a lot of people in the community say that has a negative impact on the Asian American community. Would you agree with that?
Well, it's not the first time that we've been called names, right? I mean, to your regard earlier, Tamoria, I mean, we've endured different things as well. That's just one of the reasons. That's one of the things. I don't mind what he says pretty much. What I'm afraid of is the actions of other people towards it, towards Asians. And the one thing that I have to say to that is just think about how Asians contribute to this community. I mean, a lot of our Asians, the reason why our death rates on COVID-19 is a lot higher is because a lot of Asians are on the front lines of COVID-19. We have a lot of Asians in the healthcare industry that contract COVID. And that's one, and not only that, the people that here, the business owners that we have, that people would refuse to go to because they're Chinese, for example. Well, the Chinese restaurants here buy their products from American stores, American distributors, right? They buy them from the same people, from the same companies that McDonald's would buy them from. So, and since there's no travel, you're eating with your community, people from your own community. So you're safe and you're fine.
Sonny, thank you for that.
Mm-hmm.
Welcome back to Bridging the Divide as we talk about racial disparities in healthcare. And we just left off about how COVID is disproportionately affecting minorities. So I want to open the floor for anyone that may want to touch on this topic and why. Why do you think that COVID is disproportionately affecting minorities?
Well, on the onset of COVID, when the health district started releasing their initial data numbers, we looked at zip codes in North Las Vegas, and the three zip codes in my ward were just astonishingly high. Of the deaths that were reported back then, this is probably June, July, 66% of those deaths were Black African-American population. And that was just staggering to me. So I said, why is that happening? And we targeted those three zip codes. And I call that a racial disparity because if you look at my zip codes, everything is higher. Insurance rates, groceries, medical costs. It's just high in those minority populations.
All right, Councilwoman, I'm going to have to just interrupt you there. We're coming at the end of our time on broadcast. We're going to continue our conversation right now on Facebook, ktnp.com as well. We're going to talk about some of the solutions that is coming up in the next half hour. And welcome back to our special Bridging the Divide. Tonight we are looking at racial inequalities. And before we went to commercial break on air, North Las Vegas City Councilwoman Pamela Goins-Brown, you were talking about the coronavirus and the impact it's having in North Las Vegas.
Yes, and what I was saying is the zip code, I represent Ward 2, which is the more mature area of North Las Vegas, and a very high minority population. We're about 21% African American, about 41% Hispanic. When the health district released their data, those zip codes had higher numbers of COVID-related illnesses and deaths to the tune of 66%, which was just staggering numbers to me. And I wanted to know the reason why. And it showed that those zip codes were highly impacted. And I don't know if it's lack of health care, or is it a lack of trust in the system, or why are we not getting tested? Or if we are getting tested, are we getting the same quality care as a non-minority person? So those are questions that still need to be answered as far as residents in my ward, because the numbers have not changed much. I don't know the exact the mortality rate as of today, but I don't think it's changed very much.
And then Lisa Pacheco, you're the president of the Nevada Hispanic Nurses Association. We've also seen a very high rate of Latinos getting the coronavirus. So, I mean, do you have anything to add just about why do you think that they're disproportionately being affected by this virus? Is it a variety of factors, social, economic, or, you know, where they live, the education, finances? What do you think all of that plays a role?
I absolutely do. And, you know, to the councilwoman's point, the area that she is speaking of is 41% Hispanic, and there is a huge health disparity there. My surprise comes from the fact that people are surprised by this. This is not new information. None of this is new. We know that in those same zip codes, we have food deserts, we have low access to healthcare, we have high service industry workers, we have multi-generational homes. Those facts are not new. That's all old information that we've been dealing with. And now's the time to act upon fixing some of those issues, because we've been talking about it long enough. When you don't have access, health is your whole being. It's not just whether or not you have COVID or you don't have COVID and you have symptoms. It's your whole being. It's, are you able to get food? Are you warm? Do you have shelter? All of those things impact your health, your whole person. If you don't have mental health, you don't have food, you don't have access to healthcare, you've got the deck stacked against you. And then we get a pandemic. Now you just exacerbate all of those issues that you already are living with. So you've got families who are high service industry families, you've got multi-generational families, you've got the younger folks who maybe are going out and working in the service industry, coming home, maybe possibly infecting older adults who are living in the house, affecting the family, the mental health, everything. How are we getting our food? We're in a shutdown. You're talking a food desert. We already had enough problems getting food as it was, and now you're shutting down essential services and we can't get to the food that we need. We need food to be healthy. All of those things are not new to us. So we just continue to add on to it until we fix those issues. How are we going to be healthy? We have to address those to be able to address the health. And I sympathize with our lawmakers here. You know, I know that Senator Spearman has a great history of trying to fight for these things. And I'm really happy to hear that everybody is talking about this, because until we start talking about it and do something about it, we're not going to make any progress, because none of this is new. This is all stuff that we've already had, and now it's just exacerbated because we had this horrible disease come and infect our nation and our world. So I would say we're at the point where we have to have some action.
Senator Spearman, I'm just curious to get your take on that response.
She's absolutely right. You know, here's the thing. We have known this for a while. It took COVID to direct people's attention to the obvious. COVID came along, and all of a sudden, people that were outside of our community said, oh, the sun rises in the east and sets in the west. Well, we've known that for a while. There are neighborhoods in BIPOC communities where a family-sized bag of potato chips is cheaper than fresh vegetables. And so many of the comorbidities that we have are really based in health and healthcare. You want to look back at some historical things. Think about what happened at the Tuskegee when they injected Black men with syphilis and they did not know. And so there is a distrust. When you go back even further than that, when you go back to slavery, the Black lives of those slaves did not matter. They discounted them, and we have not faced that yet. So the reason that I bought Senate Concurrent Resolution 1 is to put it in our face. We must address this, because coming back from COVID, all of us have got to come back better together. If we don't, all we're going to do is just go round and round the grid. And in another generation, people will still be talking about racism as a public health crisis. So you are absolutely right, Lisa, absolutely right.
I would just like to go back on that a little bit as well, and just kind of like put a little wraparound around this, because bringing in what Sunny said earlier and what Tamora spoke to, we don't know what it's like to walk in somebody else's shoes. I go back to what Senator Spearman said about Tuskegee. I had some of my Black friends talk to me in depth about that. And it was like a light bulb went on in my head, because I've never walked in those shoes. I've never had that experience. However, I can give you years and years of experience since being a small child of racism as a Hispanic in this world. However, I don't know what it's like to walk in an African-American shoes or a Chinese or a Filipino shoes. And I think that that's part of the reason that we have to make sure that our healthcare culture matches our healthcare, our community's culture as well. I think that's so important, and I don't want to get away from that being an important factor as well. But this is a long history. We're talking Tuskegee. How long ago was that? That was forever. We have to really get some solutions. And thank you, Senator Spearman, for what you are doing, because that's what we need. Is we need some more action. Thank you.
And how do we get past those stigmas and that mistrust that's deeply, deeply rooted in the African American and Latino and Indigenous people community, that we just do not trust the federal government? So how do we move past that? Do we address it? Do we confront it with our own community? Do we have the conversation in our household? Are we scared? Do you think that minorities are afraid to go to the doctor? They don't trust their medical professionals.
And I would like to.
Go ahead.
I was just going to say, I would like to address that in the mental health profession. So as a mental health professional, one of the things that I do, obviously I'm a white female, and, as a white female and just being a mental health professional, I know that I have power and privilege. And so when somebody comes in my office, the first thing that I do is I ask them about their experience, and I validate their experience. And that's one of the things that's one of the most important aspects of my job, is going through what it is that the trauma that they've had in their past, or whatever it is that they are going through, have gone through. And, just coming into a mental health professional's office is huge, because there is a lot of stigma to that and all different types of backgrounds. And so the fact that they're even there is a really big deal. And I've had some really great conversations with people around just being open to what their experiences are. And like I said before, validating their experiences, asking and being understanding, and knowing that I can never truly understand what they've been through, but I just want to be able to take it all in and allow them to know that I care, because that's all that I can do, and truly believe what they've been through.
But unfortunately, most people aren't going to be like you, Becky, and do that work, try to gain more cultural competency. And really what I see as the biggest problem is that when decisions about healthcare is being made, and in particular about BIPOC populations, right? Who is at the table when the decisions are being made? The tables they're not full of BIPOC individuals. They're full of mostly white individuals. And in maternal health, I've seen mostly white males a lot of the times, right? So if your voice isn't represented at the table, who's really validating your lived experience? Who can really relate to the things that you've been through? Really think about it. No one can. You have to have people who have lived through what you've been through to be able to understand how to address these issues. And there's no reason why in our healthcare system and all these organizations, all these committees that have been formed to solve the maternal mortality crisis in the Black community, there's no reason why all of these boards shouldn't be majority Black and brown people, because that is the population being most affected. We have to be able to start looking at Black people as leaders and trust them to lead us in this work. That is the solution.
Yeah, and
There's a study that was done. I agree that Lisa's so right. The study said that there's a big mistrust when it comes to healthcare because they don't feel comfortable going to, let's say, a white person if you're if you're a minority, right? You want somebody who looks like you, who understands your culture. And so to answer that question, my main solution would be, let's encourage more of our kids to get into this field, right? Yeah, encourage them to get into the field, because that's the way that we can get the same people that we want to see in this particular healthcare industry. It's a great field, so let's encourage them. There you go.
So can I just add something, because I think Sonny brought up a very critical point in this discussion. Yes, we do need to get more Black and brown people in these fields, but there's a reason that we title it systemic, because it is across all systems, to include the education system. When you stop and you look at the number of Black and brown students in schools who either drop out or are disproportionately affected by disciplinary action, those are some of the things that our children experience, and it does not give them a path into medical school. Last session, I had 2 bills, and I would encourage you all to go and look them up. But one of them is a bill, Adverse Childhood Experience, also known as ACE. And I think, Becky, you'll know this. And that is that when you are evaluating schools, you have got to take into consideration all of the experiences that population has to go through every day. Because a child who does not have food to eat, a child who is in a situation where it's drug infested, there's a child who is in domestic violence, all of those things hurt the child's learning. And I don't care if you have a master teacher. If you have children who are going through experiences that prohibit them from learning and doing their best, they're not going to be able to learn. The second bill was one that I had that requires all healthcare facilities in Nevada to conduct cultural competency training. And that was an outgrowth of some people calling me about how they were mistreated. They happen to be members of the LGBTQ community, and that's a whole different subject. But they were being mistreated because of who they were and their gender identity. So when we start talking about education, when we talk about money, all of those things, the reason it's called systemic is because it's across all of the systems that affect our lives, from birth even unto death.
I would just like to tack on to what Senator Spearman said as well. She said earlier something about leadership, and it's leadership across the board as well. It's not just that's part of the systemic problem, is when you're talking about hospitals and healthcare organizations, and you look at them and there's no diversity in their administration. That's a problem. That's a problem, because as Tamora said, we need to have a seat at the table. We need to be at the table. We need to, our boards, I sit on plenty of advisory boards. I sit on an advisory board, and I'll give you a story that when we were sitting on this advisory board, it's for college. I asked, what's the nursing ratio for Hispanic nursing students coming in? What is that ratio? And it was so small. And when I asked about it, nobody could give me any answers. And when I looked around the room, I was the only person of color in there. And I'm on an advisory board, but I'm not a decision maker. All I can do is push the question. If we don't have people who are the decision makers who are diverse, then nothing is ever going to change. So it's not just leadership of the nurses or the doctors, or it's the administrators of these organizations as well that must be diverse. And when I challenge you to look at some of the boards and some of the administrations of the hospitals and organizations around this city, and you will, or the state as a matter of fact, and you will not find the diversity of the community reflected.
Thank you. Let's bring in Maria Azzarelli with the Health District here. You want to give a comment on this subject about uh, having more minorities in these leadership roles?
Absolutely agree with that. It's more than cultural competency training. It's having the leaders, as we've also stated, and putting your money where your mouth is. As an example, at the Southern Nevada Health District, we hired a health equity coordinator. It's not good enough just to have a health equity coordinator, but that health equity coordinator has to engage the priority populations that we're dealing with, engage them in the decision making, and create strategic plans with their input, with the community that we're trying to work in's input, and not just, have a plan that a few high level people made up and then you check off the box. And that takes hard work. It takes hard work to engage the community, but we have to be committed to do that, as we also said, to dismantle the systemic issues that have been created over generations. And so definitely agree with that. And I just want to talk about the COVID situation one more time so that we talk about the latest data as of today, so that there's no misconceptions. As of today in Clark County, the most deaths, the highest death rate is among the African American / Black population here in Southern Nevada. In second place is Asian Pacific Islander population. And in terms of cases, Hispanics are in the lead in terms of cases, and then Black populations in second place. And a recent study conducted by the National Institutes of Health of 100,000 COVID cases around the country showed that the reason for the infections was because of these populations having to go into the workplace. And so that's where the infection is coming from. Of course, there are underlying conditions that are likely causing death in these populations, and those underlying conditions stem from largely systemic racism and other issues that have contributed over the years. So we at the Health District are committed to trying to, as much as we can, work with our communities to try to deal with not only the COVID situation, of course, but all of the health issues, including the chronic disease conditions like diabetes and cancer and cardiovascular disease, and trying to tackle those. And how do we do that? Well, again, it takes hard work. It takes creating programs in the languages that the people are speaking. It takes working with the community and taking your programs to the community. And so, as I said, that takes dollars, it takes time, and it takes commitment at all levels of the agency. And so I thank you for this opportunity, and I hope it's the beginning of more collaborative discussions like this.
Maria,
and I think that's a great point that I want to sort of transition to. We got about 15 minutes left because we sort of laid out some of the challenges and the problems that we've all experienced. But let's talk about what is working, some solutions to some of these issues that you have seen in your own personal or professional lives. And maybe I'll start with Councilwoman Brown. And just can you sort of relay to us, underneath this topic here, what have you seen that's been effective, if not in North Las Vegas, but perhaps in other communities?
I think for me in North Las Vegas, it's having that leadership at the table, representatives of our communities. And one of the reasons we run by wards is we try to mirror the communities that we represent. We try to serve, our wards are representative of us, and having those conversations, town hall meetings, community forums. We host several health events to get the community out, to let them know what's going on, what's available to them, and making sure that they have their voices heard, because we are the voice of the people. That's why they elect us. And so we have to have those people at the table when we have those conversations to say, what's going on in our neighborhoods? How can we help you? Or what are some of the barriers? And so we try to work cohesively to come up with some solutions. And it's a start. It's like one brick at a time. We try to solve one issue at a time, but we are such a very diverse community. We're one of the largest minority majority communities in Nevada, I think in the United States. And so it's very important to us that we highlight the diversity in North Las Vegas, and we're trying to do that as often as we can.
So I have a radical solution that I think Pat highlighted, actually. And to me, the solution is with our kids. And I believe that the only way that we can create radical change is to start in the schools and to begin at the beginning with K through 12 education, and to truly do teaching kids how to communicate, how to problem solve, working with teachers, and having actual, whether it be therapists in the school systems, but actually do teaching them one-on-one in classrooms, having, whether it's teaching them different types of relationship skills, teaching them how to actually talk to one another, how to be able to work together and problem solve. Because a lot of the things that I have noticed is that we have never been able to communicate in healthy ways. And if we can start when kids are young, then they're going to be able to grow up and have healthy relationships as adults. They're going to be able to talk with people in healthy ways. And that's going to make a world of difference. And if we do that with teachers, if we do that with administrators, if we start that now, it's going to make such a world of difference.
Maria, I want to hear from you. I want to hear from you because you actually took matters into your own hands because you were fed up with the healthcare system and became an advocate. So why did you decide to take that step?
Well, actually, I actually have probably what's considered the best outcome when it comes to maternal mortality, morbidity, right? So long story short, I had a postpartum hemorrhage in 2010. I had a miscarriage 13 months later, and I was diagnosed with PTSD and overcame those things. Why was I able to overcome those things? Because I had great access to healthcare. What a lot of people don't know is that during my first pregnancy, though, I switched doctors 3 times. Why did I switch? Because I wasn't receiving the care that a person deserves as they're going through childbirth. I was being dismissed. I was being asked questions like, are you still married? Is your husband the father of your baby? And, I was not even told at one point that I had placenta accreta, and found out through a random appointment that it was gone. I had never even been told that I had the condition. And these are the types of things that happen to Black women all the time. And so 3 years after the birth of my oldest daughter, I actually started writing about my experience. And in doing the research for my first article, it was for HuffPost, I came across the statistic that Black women die more than 3 to 4 times much than white women during childbirth and pregnancy. Why am I still here today? Because that number has not changed. That is the reason why I'm still advocating, because I'm talking about a decade ago when I first wrote that article, the numbers are still the same, and not only the same, but they're getting worse and worse for only Black and brown women. Now we're sitting in a period of time where we are being called upon to be brave, to be bold, to really be explicit in our language and our intentions so that we can fix this issue. So when we talk about starting at the beginning and education, let's start young, let's start with school. But we also have to remember the history of our country. This country was founded in racism, and we have to come from an anti-racist stance from the very beginning in children's education. I don't know how many of you have kids. You can see pictures behind me. I have a 10-year-old and a 6-year-old. They've already been through racist things. They've been on the receiving end of racist behavior. So this conversation has to start from birth. And even when you talk about systems, I know that in Nevada last year, the Healthy Start program, the grant wasn't renewed, right? So 140 families, all women of color, I believe, right? So women and children lost the program. 140 families, let's think about that. Let's really sit with that. 140 families of color lost this Healthy Start program, which would give them, again, access to education and programs of support. So now that's gone. So how do we fill those gaps? It's up to us to really stay on top of what's happening, boots on the ground with real people, and communicate those needs to our policymakers. This is about inclusivity. When decisions are being made, it's not just about including doctors and legislators and having them get together to write the policies. We need patients, we need midwives, we need doulas, we need nurses, social workers, psychiatrists, everybody, pediatricians. Everyone should be in the conversation.
And so I'm curious, I'll go to our registered nurse and Lisa Pacheco, and in talking about Tamoria there, describing herself as having to be her own best self-advocate to make sure she got the care that she deserved. I would imagine in your line of work, that is something you probably think more patients need to hear, that if you're seeing a doctor and you're not feeling comfortable for whatever reason, go ahead and try another doctor and push, and you really got to be an advocate for yourself.
Absolutely. And, you know, I just have to say how proud I am of you for being your own advocate, because as I listen to your story, I just beam with pride, because that is the kind of patient that we should all be. We should all advocate for ourselves, for our families, and that means educating yourself. And you're a consumer. You have rights. There's bills of rights that you sign off on every time you sign into the doctor's office. You have a right to understand what care you're getting. You have a right to agree with the care that you're getting. You have a right to refuse care. You have rights like you cannot believe. So the fact that you are a consumer, and if you don't like the doctor that you're dealing with, or you don't like some aspect of the office, move on, go to another provider. But when you talk about this particular story, now incorporate in it a language barrier, a lack of insurance, a lack of knowledge, fear, possibly immigration issues, add that on, and then that even complicates that pregnant woman's journey through her pregnancy even more. So it's something that, again, I'm glad we're recognizing it. And again, I'm so proud of you for being your own advocate, because we as nurses love patients when they come in and advocate, because as a nurse, my only job is to advocate for patients, period. Whatever that is, whether it's making policy, whether it's at the bedside and making sure that you get your pain medication, that is my only job, is to advocate for patients. And I take it very seriously. And I know all of my fellow nurses do as well. And so we rejoice when we see a patient come in and they have a voice. So I would just encourage everybody to speak up and know your rights.
And I just want to ask you, Lisa and Tamoria, or whoever else may have advocated for themselves when in a doctor's office, you know, what are some questions that, if there are moms or dads watching at home, what are some questions that we should ask doctors when we're sitting there and we're wondering, you know, what's wrong? I know, Tamoria, we talked about this before, how you said, hey, do you like your job? And I thought that was such an interesting question to ask a doctor. Do you care? Do you care about my life? So are there any other questions for those that are watching at home that may say, well, I didn't even think to ask them that?
I'm going to give you my favorite question to ask a physician. And sorry, docs, I know you're all going to hate me because I give this out, but my favorite question to ask a doctor when they're making a recommendation or they're doing something is that what you would do for your mother or the person that you love the most in your life? Is that who you would send your mother to? Is this the test you would get for your mother? Of course, if you love your mother. And that how they answer that is dependent upon how I act, because a lot of times they'll change their recommendations when I question them that way.
I think it's important to make a list before you leave home of the things on your mind and the questions you have, because by the time you get to the doctor's office, you never remember. You think you will, but you get there and you don't. And then also, if there's terminology being used that you don't understand, don't pretend like, you know, nod your head like, oh, okay, yeah, you know, and then you get home and you're like, what do I have? What's going on with my body? So just take the time to answer the question. But on that same note, if you're feeling like the doctor's being impatient with you, they're not giving you the right amount of time, if there is a language barrier, ask for a patient advocate who speaks your language. Most of the time, especially nowadays, there's people available in especially big hospitals, and I know in community centers as well. 9 times out of 10, there's going to be somebody. Don't sit there in fear and afraid to speak up for yourself.
That's a good point. I want to bring Sunny in on this last point. We have a minute left here, but real quick, Sunny, I mean, do you hear and experience similar stories in the Asian American
of course,
community?
you know, definitely. You know, my mother was misdiagnosed before. This is a long time ago, about 10 years ago. And that's where, Tamoria, you're right. You have the right to go to a doctor. I always, on a big issues like that, always go to a second opinion. Doctor actually just dismissed what she had and said, oh, you're probably just wanting to get out of work. Well, it turned out that she had urinary tract cancer. And if we didn't take her to a second opinion doctor, we wouldn't have found out, or maybe we would have found out when it was too late. But they were able to operate on her, and she lived for another 10 years
Honey,
before passing away. Sorry.
I just want to thank you for sharing that.